When I was in acupuncture school like 20 years ago, I remember this guy, Ted Kapchuk. He wrote a few of the really good textbooks. So when about 8 years ago I was looking more into pain research, placebo research, I got so excited to find a paper authored by Ted Kapchuk. So of course I looked it up. So a few years before I was doing all this research, he had evaluated not only acupuncture, which usually was his subject, but also shamanistic practices and just ordinary Western medicine surgery. Because he was getting more and more curious about placebo studies and about how much pain really responds to an application of a placebo. And he found out that what the researchers had seen is that placebos really have different degrees in how they work in general, but particularly well for pain. So you give somebody a sugar pill. That's the typical thing about a placebo treatment. You just give them this little pill, and either it has the real ingredient or it doesn't. Often the researcher doesn't even know, just so that there's no influence by their confidence and how they work with that patient. So they tried out different colors of sugar pills, and they found that really the color changes the effect, even if the only difference is one color or the other color. Look it up, it's amazing. Then they tried different types of treatment. So you give the one control group a sugar pill, you give the other group an injection. And it is exactly like you would assume, because you already know this. The people who get the injection and the people who get the sugar pill respond very differently to the almost identical painful sensation. So they do this typical test, stick their arm into a bucket of ice water. With the one group, they say they feel real pain in that arm a lot faster than with the group that did the actual injection, that told them that they have a drug for total anesthesia that is really going to cut out the pain signals. For them, it took much longer because people feel like an injection, that's a serious treatment. Just taking a little pill, not so much. So from here, we already know there are different levels. And Ted Kapchuk was thinking, okay, if we already know this, what if this treatment has a very high price? And he found, yes, there were studies about that. If you have a treatment that is seen as very cheap, even if it's just a pill, you tell the patient, oh, this cheap thing has this big discount. This would be something, if this helps, we can give it to lots of patients easily. And then there's another group, and it's like, yeah, there's this great new drug, but it's very expensive. So they tested that out. And of course, the very expensive one works so much better than the cheap one, even though it's the exact same sugar pill. So Ted Kapchuk was using all these different things, and he was thinking, okay, if we have a lot more influences on the experience of a treatment, how does that work? And he found out that the more you add on, the more effective the treatment is. So he was looking at that, of course, because he was really involved in placebo studies around acupuncture. Like I said, that was his research subject for a long time. And it got so frustrating because they found in study after study that the better they make the fake acupuncture, the closer is the group in their reactions to real acupuncture and fake acupuncture. Of course, you can argue that after a while, even the fake acupuncture becomes real acupuncture. Or you could argue that the real acupuncture wasn't real acupuncture because they can't completely test out every patient based on Chinese medicine criteria. So it becomes very difficult. In order to make this a little bit simpler, Ted Kapchuk decided to just focus on everything around the treatment because there were these things about pricing and color and all these different influences on a painful experience under placebo research. And then he started looking at, okay, if we look at this framework, what do we see there in different environments? If you have somebody go to the office of an acupuncture physician, there are specific smells in the air. There are different decorations on the walls. There might be, this model that shows all the different meridians on it. There might be music in the air. So you already have a reality that is very different from what that patient experiences in their normal environment. And it turned out that a treatment done in a practice that is decorated very much after this cliche Chinese medicine concept versus a practice that just looks like the physical therapist's office, that the results are better in the one that is totally decorated and has all these different sensory experiences. Because it gets the patient already out of their reality. They feel like this is so much more powerful, this is authentic, this is really Chinese. This is not just somebody who learned this in a weekend seminar. So the effect is a lot higher. The people get more pain relief. And in the paper that I read, Kapchuk went even further, and he started looking at shamanistic traditions, and then he was looking at how we do surgery. And in all these different senses, we have a different environment, we have specific clothing, we have smells and influences that we don't have in our normal life. And it doesn't really matter which ones these are. In all of these three different scenarios, we get into a world that is completely different from our own. And the more different it is, the better the efficacy of the treatment. Now, I love this particular paper because he really went through a lot of different studies that were looking at how much placebo is there in a shamanistic treatment, in an acupuncture treatment, but also in standard Western medicine and surgery. Now, I recommend you really look into the placebo-controlled surgery cases because it's crazy. I mean, they had these typical things where they're, treating arthritis of the knee, torn cartilage, all these kind of surgeries that are standard. And in the placebo group, they did nothing but a little cut into the skin, and then they sewed up that cut again. So it looked like that person had received the same kind of surgery. And they don't know because they were under general anesthesia. They're just being told. And in all those cases, the results were almost the same. So the person who really got some of the cartilage taken out and the person who just got this little cut on the skin, they had the same results in pain relief. In pain relief that was permanent after the surgery, not just a few hours. Because going under surgery is the highest placebo effect that you can possibly have. You also have that in surgeries of the spine, and it is this typical thing of the herniated disc. And this is the reason why nowadays, if you're getting a consultation by an orthopedic surgeon, in a lot of cases, they're going to tell you, you're not really a candidate. Because by now, they are really getting very careful where they're recommending it and where it might not make sense. Now, where we're not far ahead yet is how can we create an effective treatment that really, really does its job, that's not just a placebo, but we utilize all these effects out of the placebo studies to just make it so much more impactful. And in my opinion, we can use placebos consciously. And maybe we should drop the term placebo because that always suggests that it's not real. But like I said before, the experience of pain is just what our brain creates anyway, based on experience and expectations. So how about we say that we use a lot of the framework around a treatment in order to treat the nervous system? And instead of saying this is a placebo treatment for pain, we say this is the treatment for your nervous system in order to treat your pain.